Everyone, I welcome you all to today's session. Today's session is going to differentiate between the surgery for the face, which is called as the facelift, and the surgery for the neck, which is called as a neck lift. So a lot of people don't really understand whether facelift is going to tighten only the upper part of the face, the lower part of the face, or the neck. So therefore, I thought it's a good idea to talk about this important aspect of a facelift, whether a facelift is only for the lower face. I'm Dr. Parag Telang. I'm the founder and director of Designer Bodies, our Center for Advanced Cosmetic Surgery in Mumbai, India. And you can reach me on Dr. Parag Telang on Instagram. And of course, you can follow me on the same page on Facebook as well. So when we talk of facelifting is something which normally is required as we age, and that's because as we age, gravity causes a lot of changes in the face. So a face which is nice and tight in the 20s and 30s starts to develop sagging in the lower portions. The neck also undergoes similar changes. So there may be some bands seen in the lower part of the neck. There may be excess skin that is seen in lower part of the neck. And of course the projection of the face reduces. So there is loss of volume, loss of fat from the temples, cheeks, and also in the chin area. And therefore whatever changes have happened in the face, the same changes also happen in the neck. Over a period of time from 20s to 30s to 40s, 50s and 60s, there is progressive accumulation of fat in certain areas of the face. So a face which was nice and tight in the younger age becomes very bloated, it becomes broad, and it has a lot of fat after fat accumulation in the older age. So there are eye bags that you can see. There is prominence of this lower part which starts to hang, which is called as a jowl. And therefore facial aging is something which is going to occur over a period of time, face as well as the neck. Kushi Gupta is asking about scar removal surgery. Yes, you can send your photos, Kushi. I can see what can be done. So this photo is essentially to show the changes that have happened in the face as well as the neck. So in the face there is a looseness of the upper eyelid skin, there is an eye bag in the lower eyelid, there are prominent laugh lines, and in the neck area there is this jowl which starts to hang, there are bands in the neck, and overall the face looks tired or the face looks aged. Now sometimes the neck ages more than the face. Like in this particular gentleman who had lost around 25 kilos of weight, what had happened was that his neck was pretty bad. There was a lot of loose skin in the neck and the neck contour was missing. This was because of aging and weight loss, and he came to me requesting for something for his neck to make it look tighter and younger. So when we compare the difference between facelift and neck lift, we need to take a very balanced view. It is of course always easier to do both surgeries together because it's one single surgery and one single recovery, but sometimes patients need only a face tightening wherein they need a surgery called as facelift, and some patients need tightening only of the neck, which is called as the neck lift. So how essentially a facelift or a neck lift is performed is through an incision which starts in the hairline, then it curves in the crease in front of the ear, and then it goes behind the ear into the hairline. So even if a lady ties her hair up like this image, the incision is still hidden in the natural creases of the face and it's not very visible. If it's only a facelift that a person is going for, then the incision is only in the front of the ear and going into the hairline, and if it's only a neck lift, then the incision starts from here and goes only behind. So unless a facelift and neck lift is done together, the incisions may be separate. So after the skin has been elevated, this is the skin layer which has been raised, then the deeper layer of the face is called as the smash layer. And in the technique that we use, which is called as the deep plane facelift, this layer of smashed tissues is lifted and the muscle layer underneath that is tightened. Then this smash layer is tightened and stitched, Now when somebody wants to do a face and a neck lift, then we create two different portions of this mass layer. One portion tightens the neck and the other portion tightens the face. So there will be two stitches. One stitches will be here on the zygomatic arch and one stitching will be here in the neck area. So this particular part of the smash gives tightness to the face and gives lifting to the face, and this particular portion of the smash tightens the neck muscle and gives a very good jawline. So depending upon whether a person is looking for a face tightening or a neck tightening, we can decide which particular procedure to choose, and there is a lot of variability in these procedures, so we can pick and choose depending on each patient's requirement whether to do only a facelift or to do a face and a neck lift or to do only a neck lift. So let us take a look at some of the advantages of doing face and neck simultaneously. So if you are in your 45, 50, 60 kind of age group and both the face and the neck have started to become loose, then it is advantageous to do both face and neck together. The advantages would be that it would be one single operation. So in the same recovery time of 10 to 15 days, you are done with both face and neck. As I showed you in the previous image, the same incision of a facelift continues behind the ear and from there a neck lift is done. So it is essentially one single incision. Both superficial and deep structures of the face and neck can be addressed at the same time, and therefore the entire result looks more harmonious. You will understand it better when you see actual photos. So this particular patient who had lost 25 kilos of weight, you can see that the face has started to have looseness or sagging. At the same time, the neck is also showing some neck bands and the neck has become loose. And after the face and neck lift, see how tight his face looks or how slim the face looks. That is because the loose skin which was giving broadness to his face and neck has been lifted and tightened. You can see it better in the 2/3 view. There was lot of loose skin in the neck, lot of loose skin in the lower part of the face. So when we do a combined facelift and the neck lift, you can see that his face has also got tightened and his neck has also got lifted and tightened, and that's what gives a lot of difference. When you see in the profile view, you can see that now post surgery he has a proper neck angle. You see before the surgery how his skin was loose and hanging, and he used to hate that neck. He was a fitness freak, he used to do a lot of gymming every day, but he was not able to tighten the neck muscle because this is like an elastic. If with aging or with weight loss the muscle loses its tone, then it's very difficult, almost impossible to tighten the muscle just by dieting and exercise. And in such circumstances, sometimes we need to take help of a surgery, either a facelift or a neck lift, to tighten the loose areas of the face and the neck. Now sometimes we do get patients where the face is quite okay and it's the neck which has started to sag or to become loose. So if either you do the face separately or the neck separately, somehow the recovery is overall faster. Only the face or the neck will have swelling because it's only one portion which is operated, and sometimes the face or neck may of course have more wrinkles. So if the face is more wrinkled, then only a facelift, not a neck, and if the neck is more wrinkled and loose, then only a neck lift without the facelift can also be done. And these procedures can be done separately, so the recovery is faster and the patient can have a good outcome. This is an example of a lady who had lost a lot of weight, and after her weight loss and of course with aging, there was a lot of sagging in the neck area. And you can see after the deep plane neck lift that she has a proper jawline, and the definition of the entire jawbone is standing out, and the neckline has been properly contoured, and the neck looks much fresher, much younger, and she was very happy with the outcome. So facelift and neck lift are procedures which may either be done separately or they may be done together. The most common technique that we use at our center is something called as a deep plane facelift. In a deep plane facelift, the deeper layer of the face is also tightened by taking stitches inside. If you just try to fix the skin, it is a mobile layer, it's not going to remain tight for long. after 3 months, 6 months, you'll again have sagging in the face. But when the deeper layer of the face or the muscles are tightened, then it gives a very good harmonious effect, and it, in terms of longevity, it has a longevity of at least 8 to 10 years. So it is not like a non-surgical modality where you need to keep doing it again and again, so there is no maintenance, and therefore a lot of women after their 50s, they go for a surgical kind of a tightening because the result can be quite dramatic and it has a lot of longevity. These surgeries are done under sedation. So typically it takes around 1 to 1.5 hours per side. So roughly you can say that it will be a 3-hour procedure. After the surgery, there is a crepe bandage which is tied around the face and the neck to allow the skin to fix nicely, and so that there is no fluid or blood accumulating under the skin. The bandages are opened after 24 hours to give you a look at how the face is looking, and then they may be reapplied. After a few days, you are given something called as a chin strap. So this chin strap is like a cotton belt which you need to wear. It has velcro on the top that gives compression to the face and the neck, and that also allows the face and neck muscles to heal properly and to give a very nice tight effect to the face and the neck. So friends, whether you are a good candidate for a facelift or a neck lift, that your plastic surgeon can tell you once he or she has seen you. Whether you can do both together or not also depends on your anesthesia evaluation. If your heart condition is good, you don't have blood pressure or diabetes, then you can do both the procedures together without any problem. These are very safe procedures. Of course, any procedure on the face, you can expect to have some swelling, you can expect to have some bruising, which may remain for 1 week to 10 days, at the most 15 days or so. So plan these procedures in such a way that you don't have important events, meetings or shoots happening during this 15-day period. Once the healing has happened, the face starts to look dramatically better, much fresher and younger. Of course, for the incision marks, there are some creams that you need to apply for the incisions to fade away. So the line of the incision initially may look like a pinkish line, and over a period of few months then it starts to fade away. But any which ways, the incisions are quite concealed in natural creases, and by keeping your hair long in those areas, you can hide the incisions in the initial part. So this was some information about facelift and neck lift, and whether face and neck lift can be done together, and whether a facelift addresses only the upper part of the face or lower part of the face. So I hope you understand now that facelift addresses the entire face. Neck lift is something which will address your neck. Whether you need facelift and neck lift both or separately can be discussed with your plastic surgeon. I thank you all for attending today's live, and I wish you all a very happy Diwali. I will catch you all now after Diwali break, and I wish you all a very happy Diwali and a prosperous New Year 2023. Thank you very much and good night.